once in a while, what can be the slow-moving pace of medical research makes a sudden leap.
Top global doctors say that's exactly what's happening this year with drugs to treat obesity. Seth Kaplan live with more on this. Seth.
Alicia and Dennis, here's how big a deal this is. A few months ago, we learned the 40-year-old Jenny Craig weight loss chain was closing. Well, some experts say that long history was cut short partly because of a weight loss world that's now changing not over the course of decades or even years, but months.
This change has been very, very fast.
How fast?
Definitely within the last 6 to 9 months, as we've seen different therapies that are available to help treat this chronic disease.
That's Dr. Fatima Cody Stanford, a Harvard researcher who was among the first experts a decade ago to talk about what obesity wasn't.
If we look at things like Jenny Craig, et cetera, it really hyper-focused on lifestyle and behavioral strategy, something the person needed to do to fix themselves.
Experts like her now say it's a chronic disease, one they noticed seemed to benefit from a type 2 diabetes drug called Ozempic. Next came Wegovy, same active ingredient but higher dose, specifically for obesity.
This class of medication works on the central pathways in the brain that regulate food intake. They tell us to eat less, and it tells us to do that on a consistent basis. So these medications are working specifically on that pathway.
She says the average patient loses more than 15% of their excess weight.
To simplify that, if you were carried 100 pounds in excess, that would be on average about 15.5 pounds. But for some people, they can be high responders, so maybe they lose 30 of those pounds.
The weight loss drug landscape has been really changed with the introduction of Wegovy.
Philadelphia-based Dr. Charlie Seltzer.
When somebody has high cholesterol, you don't think twice about putting them on a cholesterol medication. But when somebody's overweight, we often hear people say things like just have better willpower or control or follow this diet.
Diets Dr. Stanford says don't work for most people. She says surgery, like sleeve gastrectomy, is still the most effective treatment for obesity. Drugs like Wegovy are second most. Not everyone can take them, not pregnant women, not people with personal or family histories of thyroid cancer. But she says the main reason more of her patients aren't on the drugs yet is because supplies are scarce and the cost is steep.
And what do I mean by steep? We're talking on the order of about $1,400 a month.
Yeah, Medicare and Medicaid don't cover the drugs yet, neither do some private insurance plans. Dr. Stanford says she thinks that's short-sighted because not treating obesity is expensive when you end up having to treat more ailments, like heart disease and strokes later.
Great info. All right, Seth, thank you.